Buonasera a tutti. It's an honor to me to be here in Rome again to talk about the use of iOS levonorgestrel Mirena in the treatment of fibroids. I will know that iOS levonorgestrel and high concentrations of levonorgestrel suppress the proliferation of uterine myometrial cells. Maru and collaborators observed this in contraception in 2007. Shu and your group observed the same in 2010. High concentrations of levonorgestrel leads to a decreased proliferation factors like IGF-1 and increased apoptosis. This observation leads to use of levonorgestrel in the treatment of bleeding and fibroids. In about fibroids, most studies show that little change on the fibroids volume, but a good results in the menstrual patterns. We observed in our first publication in 2007 a slight reduction in uterine volume and a better menstrual pattern in those patients. Kaunitz in 2011 observed the same. Some studies observe a great reduction in the volume of uterus and fibroids. Grigorieva was the first one to publish in 2003, but the others studied not observe it, only a slight reduction in uterine volume. Kriplani published in 2012 a decrease in the menstrual volume in patients that use iOS levonorgestrel in fibroids and idiopathic menorrhagia. This is our study. The objective was evaluate the total uterine volume, the volume of fibroids isolated, and menstrual patterns in women use levonorgestrel treatment of HMB and fibroids. It is a prospective control cohort study with 198 consecutive first in session of iOS levonorgestrel at Persona Center of Gynecology and Women's Health, São Paulo State, Brazil. The methods. We use the clinical and ultrasonographic evaluations of insertion of levonorgestrel at insertion, 3 and 6 months, and every year up to 5 years. We calculated the total uterine volume and the volume of fibroids using the ellipsoid formula. This is the usual form of observed volume of uterus and fibroids. In case of multiple fibroids, the volume of each fibroid was added. Menstrual bleeding episodes were recorded for the patients. 198 first in session, divided in 3 groups. 59 women with fibroids, 75 women with heavy menstrual bleeding, and 64 women using Mirena only for contraception. This is the control group. Women who had an endometrial echo more than 6 millimeters or increasing of ultrasonographic echogenicity head endometrial biopsy. And we encounter 15 endometrial biopsy performed, 9 samples with endometrial hyperplasia, 5 women with secretory endometrium, and 1 with proliferative. In all those women, the levonorgestrel IUS was inserted. Simple endometrial hyperplasia is a good indication for use of uterine levonorgestrel. In this chart, we observe that in contraception group, the volume stay in the same plateau in all the periods of the study. In 5 years, is the same of the insertion. We not observe a decrease or increase of uterine volume. But in the group of heavy menstrual bleeding, that we observed that the patient was with greater volume when we compare with the patient of contraception group. And we observed a significant decrease in the first 3 months of study. And still, this is the same in all the periods of this study. And this was significant. And then we conclude that we observe a slight reduction in the uterine volume. In the patients of fibroids group, we observe the same. The patients experience a great uterine volume in the beginning, but we observe an important decrease in the first 3 months that remains at 48 months. But in the end of the study, we observe an increase, a slight increase, not significant, but it is a question. Maybe the concentration of levonorgestrel in plasma in 4 years is the explication for this observation. When we talk about the fibroids volume isolated, we observe that is not significant. And then we conclude that the volume of fibroids is the same at the beginning and the end, and at the end of the study. This is an important conclusion. When you observe the menstrual pattern, and you observe amenorrhea in contraception group, in the beginning, 30% of patients with amenorrhea, but after 1 year, we observe 50% with amenorrhea. It's a good pattern in these patients. But we observe that amenorrhea status leads more time to be stable in patients with HMB. You note this in all the period of the study. But in the group of fibroids, the increase of amenorrhea is more we observe that amenorrhea in patients with leiomyoma depends on time to be equal of the other groups. Okay? This is important to counseling the patients about it. for evitate the abandon of the methods in the beginning. But patients with higher bleeding accept more these patterns of bleeding. Spotting is the contrary. Spotting is more frequent in patients with fibroids and HMB and decrease in time, but taking more time to decrease. 2 years to be in this stable patterns. The question is, and the follow-up of events, what occurs with these patients? In the contraception group, we observe a little taxes of expulsion, 1.6. Heavy menstrual bleeding, 4.1, and fibroid is more, 6.2. And we made more hysterectomy. It's logical in groups of fibroids when we compare with heavy menstrual bleeding, and it's logical not hysterectomy in group of contraception with normal uterus. Here we observe 2 fibroids, intramural fibroid, with levonorgestrel in the cavity. This distance is not important because if IUS levonorgestrel is upon the segment, is normal. When we talk about a fibroid defined like this, the volume stays at all the time in the same volume. It's not a reduction of fibroids defined like this. Here, one patient with a fibroid that made the Mirena like a curve, but the patients have a good menstrual patterns after insertions. This is a contraindication when you had a cavity with abnormal size or with abnormal form, but we insert with good results. Here, levonorgestrel touching the Mirena in the fundus of the uterus and biggest fibroids. Here, maybe adenomyoma with the Mirena touching the adenomyoma with good results in a patient of 42 years. And here, 3 fibroids with Mirena at the center, well located and with a good pattern. The conclusion of our study is levonorgestrel IUS appears to contribute a slight reduction in the total volume of women with heavy menstrual bleeding or with fibroids. No significant reduction in the volume of fibroids was observed. Expulsion and hysterectomy rates were higher in women with fibroids. The amenorrhea prevalence was higher in the group of contraception, the control group, and is reached more quickly than in groups with HMB and fibroids. Nevertheless, the majority of women gaining better menstrual patterns after the insertion of levonorgestrel IUS. Thank you for your attention.